All right, we are back and we are discussing some more unfortunate information as it pertains to the trans community, trans people in the USA. Tennessee Senate passes an amended trans healthcare tracking bill at the state level in Tennessee with the Tennessee State Senate. A bill that requires doctors to report on transgender related healthcare has passed the Tennessee Senate as written. Okay, so just kind of give a brief overview of this. Senate Bill 676 in Tennessee is a proposed state law that will likely require doctors to report on transgender related healthcare ahead of its near final vote. Tensions have been high around a series of anti-LGBTQIA bills proposed this year. Activists have opposed the tracking bill throughout the session, claiming that the policy would effectively dox transgender or other non-cisgender people, even though the data reported to the state legislature by the bill would be in aggregate and not tied to individuals. Ahead of the House vote in March, activist Heather May was physically removed from the Capitol by state troopers. Duran Annalise Johnson, co-chair of the Nashville Committee of the TEP, which the TEP is the Tennessee Equality Project, okay, said the bill was, quote, inherently problematic, even if individual details are not tracked by the state. Quote, this is a bill that gathers data on trans and gender diverse patients throughout the state, as well as providers. Johnson said ahead of the meeting, quote, it asks for details around prescriptions, around what's discussed in medical visits, around how long somebody has been in treatment or has been having gender care discussions with their providers. Among privacy concerns, Johnson is critical of the bill for singling out non-cisgender patients, though many cisgender patients also receive some of the same healthcare treatments, including taking hormone supplements like testosterone and estrogen for different conditions. To specifically target transgender patients, the bill is written to require healthcare providers and insurers to track gender transition and detransition treatments, quote, including mental health treatment, medical interventions, and surgeries that stop, reverse, or help an individual cope with the effects of a gender transition procedure due to the resolution of any inconsistency between the individual's sex and the individual's perceived sex or perceived gender, end quote. And quote, all of that is prognostication about what medical decisions someone might make in the future, quote, Johnson said, quote, so we collect data on everybody who's taking hormones. So that's something to think about because, again, and this is what I've been saying on my videos for years, you're only targeting transgender people, intersex people, gender fluid people, non-binary people. And again, it's specifically targeting the trans community, transgender people, anyone who falls under the transgender term, which the transgender term in of itself is an umbrella term, and there's various other identities that fall under it. And again, it's transphobic. You're literally only targeting trans people. Meanwhile, it's okay for a cis man to receive testosterone because he has testicular cancer and had a testy removed. It's okay for a cis woman to receive estrogen because she's going through menopause and or because she had a full total hysterectomy. I mean, what are breast implants? What is a BBL? What are hair transplants? These are all gender-affirming care. And arguably, most of our healthcare is gender-affirming care. And the reason I say this is most of the healthcare that we receive is based on your gender. Surprise, surprise, surprise. So most of your treatment plans, most of your procedures, most of your prescriptions, you'd be surprised, is gender affirming care. So the sponsors of the Tennessee bill were State Senate Brent Taylor, who is a Republican representing Memphis, and another representative, state senator named a House representative, Jeremy Faison, who is another Republican representing Cosby in Tennessee, said the bill is intended to provide public transparency into the number of trans patients who choose to detransition, to address unfair, quote, one-way transitioning, and ensure patients can receive care if they choose to detransition, which is bullshit. Because if a person wants to detransition, they can do that. And they do receive care. They receive a lot of care. They receive a lot of support. Meanwhile, people who are actually trans and who are seeking to transition are the ones that are not being able to get care, being denied support, being denied resources. And then this is what cracks me up about this. These are the same Republicans who don't want people to have universal health care. But they're so concerned about your care, but they don't even want you to have health insurance to begin with. They don't even want you to have a job that pays a living wage so you can actually afford health care. Better yet, they don't even want you to have access to housing. You know what? Let's get back to the article. Quote, what about the poor folks that took up the transition nonsense and they transitioned to a sex or a gender that they thought would solve their problem and they just want to be left alone? They want to be able to go back to their birth gender. Quote, and this is what Republican State Senator Brent Taylor said. Why the party that is always for universal health care and for choice? They are for choice, but only one way. Quote, I just find that curious, he added. That's the same thing we can say about the Republican Party. You know, you're the party for small government, right? But only when it benefits you. Because how are you for small government, but yet you want the government in the doctor office with everybody? And then mind you, you want the government in the doctor office with trans people and cis women. Because notice, y'all don't have a problem with cis men doing whatever the hell they want to do with their bodies. Wait, yeah, you do. The only time you care about that, only time you want to try to police cis men is when you're trying to force them to be sent away to be drafted into a war so they can die for rich and wealthy people and corporations. That's when you're mandating what they can and cannot do with their body, right? Yeah. Also, this is the same party, Republicans, who love to talk about freedom, yet that only seems to be for white, heterosexual, cisgender males with money. Everybody else, you don't get to have that same freedom. You don't get to have those same rights. Okay. After more than half an hour of debate, the Senate passed the bill. Again, State Senate, Tennessee State Senate. They passed the bill 24-7 with every Democrat and Senator John Stevens, who is a Republican in the Tennessee Senate, representing Huntington, voted against the bill. They also added a pair of amendments to allow the Attorney General to investigate those who do not comply and to remove county-level data from the required report. Taylor said his amendment removing county data was inspired by a conversation with protesters who raised concerns about individual HIPAA rights if there are a limited number of transgender individuals in a lower population county. Quote, the amendment just says that we will not report in the public-facing website the county in which someone transitioned or detransitions, Taylor said. noting that Faison had agreed to the change in order for the bill to pass. The House will have to take a second floor vote to reconcile the spirit version of the bill. Protesters said ahead of the meeting that the amendment was a small victory, but that the bill is still part of an effort to intimidate the trans community and inch toward more restrictive policies in future sessions. Despite the apparent olive branch, Taylor also somewhat admonished protesters. Quote, "Those who protest our bills, I think, would do better if they would engage with us and talk with us about their concerns, rather than immediately screaming at us when we walk into the chamber, calling us fascists," Taylor said. Democrats, including Senator Ramesh Akbari, who's a Democrat in Tennessee, okay, representing Memphis State Senate, criticized the bill, mentioning privacy concerns, but also a provision of the bill that prohibits localities from banning conversion therapy. Quote, "It is unfair for us to legislate in a way that allows or bans the banning of behavior or treatment that could be harmful to someone," Akbari said. Quote, "There is ample evidence on the dangers of conversion therapy. There are dangers in forcing these young people to go into these programs." Akbari acknowledged her argument was an uphill battle following a U.S. Supreme Court decision earlier this month, which ruled states cannot ban conversion therapy because it violates the First Amendment. Which is ironic, right? Because again, the issue with all of this is how everyone interprets laws and policies completely different, and a lot of it is based off of their religious viewpoints and their political viewpoints, right? I do it, you do it, we do it, most of us do it. And because of that, leaving it up to interpretation causes a lot of problems, because you're saying that banning conversion therapy violates the First Amendment right, but then you're also telling trans people that they don't have the First Amendment right to freedom of expression. And they don't have bodily autonomy. And you don't want us to speak about being trans or intersex or LGBTQ+, because apparently that's also being seen as hate speech by educating folks about trans community, transgender, people of color, LGBTQ+, gender identity. Again, hypocrisies and double standards. Also, you're pro-life, but you don't want trans people to live and exist. Doesn't really seem pro-life to me either, but okay. This coming from the same group that was screaming "my body, my choice" when it came to wearing a mask, but yet it only applies to them, because when other people say "my body, my choice" when it pertains to being a woman, being trans, all of a sudden that doesn't apply anymore. Again, double standards, hypocrisy. Still, she argued that the state would not pass any policy that would push a vulnerable person to self-harm as they work through their gender identity. Quote, "This is not just a vanity decision, but instead it is a life-affirming care," Akbari said. This story, again, was originally published by the Nashville Banner and distributed through partnership with the Associated Press, and that link is in the description box below. So I think it's just really important that people are aware of what's going on, because state to state, we are seeing anti-trans legislation, everything from banning you from using the bathroom to having health care to existing as who you are in the public, right? I've got more videos, but this information is in the description box below, and I'm going to continue to say, cisgender people, you need to speak up about what's going on. A lot of you have trans family members, trans friends, trans colleagues, and many of you are engaging in romantic relationships and or sexual activities with transgender people, intersex people, gender fluid, gender queer, non-binary people. And I'm just going to keep saying it. It's hard to think somebody cares about you when they're constantly mute and quiet and silent when everything is going on. Never speaking out, not going to protests, not even having the care to check in to see how you're doing. Again, we need allies and accomplices. Enough of the, oh, I love you, I care about you, but I do nothing to show any of that. Nope, actions over words any and every day. Trans lives matter. Trans people deserve to live and thrive just as much as cisgender people. And I will continue to use my platform to speak out about the issues pertaining to the trans community, pertaining to the LGBTQ plus community. You know, I use my privileges to fight for social justice, equity, freedom, rights, liberty, and justice for all marginalized people. Point blank, period. And I recognize my privileges on a consistent basis. So I am going to continue to use these privileges that I have to help others. And I strongly encourage you to do the same.